Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum. This course is about patient safety. It is based on patient safety curriculum guide designed by WHO expert. This session will give an overview about the course. It will show the important topics will be discussed during the course, plus some milestone and basic statistics. St. Louis was the first person to introduce hand wash. With this basic measure, it reduced the maternal mortality significantly. This happened in 1847. In 1854, Florence Nightingale, she was a pioneer in sanitation and hospital hygiene. This during the Crimean War, this basic intervention it reduced infection and epidemics. Then there are many activity like Flexer report and development of anesthesia safety. In 1966, Don Obedian introduced basic quality measurement tool focused on structure, process, and outcome. The major eye-opener was introduced by Harvard Medical Practice Study in 1991. The study revealed significant preventable harm rate in hospitalized patients, bring attention to patient safety as a systemic issue. The major milestone is related to publication of Institute of Medicine to Err is Human, which revealed that 98,000 deaths due to medical error. Since then, many activity and initiatives were taken to improve patient safety. The WHO launched Global Patient Safety. The first challenge about clean care is safer care, promoting hand hygiene and infection prevention and control. The effort continued, and in 2008, the WHO released the second challenge, Safe Surgery Saves Life. The third challenge was released in 2017. It's about medication without harm, promoting medication safety and safe prescription. During this process, the WHO expert created a patient safety curriculum guide. It's a multi-professional curriculum addressing issues related to patient safety. In this curriculum, they have 11 topics. We elected to discuss topic from topic 1 to 8 in these sessions, and then we will have different course for infection prevention and control, medication safety, and surgical safety. Topic 1 discuss what is patient safety. It highlights the magnitude of the problem. Unsafe care is one of the top 10 leading causes of death throughout the globe. 83% of the harm is avoidable. This condition affects patients attending hospital care and primary care. In primary care setting, 1 in 4, that's to say 25% of patients are harmed during the process of care. In 2013, over the 420 million hospitalized patients, there are around 43 million who experience adverse event. In hospitalized patients, 75% of adverse events occur in low and middle income countries. Topic 2 is about human factors. Applying human factors is important to patient safety. This could be related to our perception or our ability to interact with the environment and surrounding and the machines. Human factors could be related to our emotional state or physiological state, when we are tired, when we are sick, when we are sad, when we are excited. All these can affect our ability to interact with the surrounding. Human factors could be related to our mental state, to our capability, our limitation, and our interaction with the machine, human machine interface, and whatever, how we can handle the environmental condition, and our physical and emotional state. Topic 3, understanding system and the impact of complexity on patient care. Patient process can go through a lot of and complicated pathways, and it interacts with different people. Understanding the system, the capability of the system, the limitation of the system, and designing the system to allow us to function well and putting human factor in the context can improve patient safety. Topic 4 is being an effective team player. Patient process, patient journey, it goes through multiple team, administrative team, doctors team, nursing teams, and multidisciplinary teams. And each team has different player: senior consultant, junior resident, intern, student. Being effective team leader can improve patient safety. Topic 5 is about understanding and learning from errors. Errors are inevitable. We need to differentiate between errors and violation. We should explore human factors related to the system and individual leading to errors, and we need to analyze error, root cause analysis, to figure out the cause so that we can avoid errors in the future. Topic 6, understanding and managing clinical risk. Explore how to identify, assess, measure risk, and then how to mitigate these risks. Risk analysis can provide opportunity for learning and improvement. At the same time, we need to assess our fitness to practice. This requires a conscious analysis of our situation so that we can mitigate our own risk if it is related to knowledge, if it is related to sickness, or any other factors. Topic 7, introduction to methods of quality improvement. Learn about tools of quality improvement and change concept. We're going to use the model of plan, do, study, act. What are we trying to accomplish? How we will know that a change is an improvement? What change can we make that will result in an improvement? And how to make quality improvement a sustainable activity. Topic 8, engaging with patient and carers. Patient is the only constant in health care. He is the one who experiences all the activity of health process and health delivery. Patient engagement can help to improve outcomes and reduce errors, and it improves quality and safety of care. And also we need to understand and learn how to deal with patient after adverse event, how to recognize and how to manage and how to handle patient after adverse event. The final topic is about culture of safety. In this curriculum guide, culture of safety is scattered in many chapters. We elected to put a special topic about culture of safety, institutional role and individual role. For institution, it's about creating psychological safety, active leadership, transparency, and fairness. You as individual, you have to differentiate between system and individual error, to be respectful to other colleague, and actively set a positive tone when working with team, and routine use of structured type of communication. We're going to explore all these in the culture of safety session. So this is an overview about the patient safety. We will discuss each topic in 1 or 2 sessions. So see you there, and thank you very much.